Good morning, and welcome to another edition of the Black Male Podcast. I am your host, AP, and today we will talk about the term and the concept of mental health. Joining me today, I have Dr. Brittany Johnson. She's a dual board certified nurse practitioner. I'm going to let Dr. Johnson introduce herself to everybody, and then we're going to get started. Go ahead, Dr. Johnson.
Good morning. Like he says, I'm a dual board certified psychiatric nurse practitioner. I first started with being a registered nurse. Then I went back to school and decided to become a acute care, critical care nurse practitioner. Worked as a hospitalist, and then decided to further my education and get a psychiatric background and specialty on top of that. From a small town in Louisiana called Buras. You may not have heard of it, and very, very isolated, which further had me decide to seek more mental health. We were very ignored being in a rural area. That's what kind of sparked this journey.
That's good. That's good. We briefly talked before the show started about being in small towns, and I shared an experience with you with one of my coworkers that I had, and how he had a mental health episode, and just to see that at that time, that was about, I want to say 15 years ago. It's hard for us to understand where someone is if, number one, we haven't experienced that or we don't know anyone that has gone through that. So that's one major thing, and I'm glad that you said that about being black in a small town or a small area where there's not a lot of advantages and options for us. All right. So we're going to get started with today's show. As always, I like to define the show's topic, and today's topic is on mental health. So mental health is defined as a person's overall emotional, psychological, and social well-being. It is an essential part of a person's quality of life and overall health. So part of what today's show is that I want to open the door and have this open discussion and send this message out to the masses of why mental health is important. If we think back about 5, almost 6 years ago, there was a major thing that hit everybody called COVID. And COVID changed the game and changed a lot of people's lives. You had people that lost a lot of things. They lost their livelihood. They lost their homes. They lost jobs. They lost a lot of things. And what happened was hospitalizations, they had risen based on the things that people have experienced. You want to share with me, Doctor? Oh, I lost her for a little bit. We'll see when she jumps back in. But I want her to jump back in and talk about her experience with talking about how the mental health side on her end, how COVID had helped or hurt the field of mental health. Okay, give us 1 second. We'll get her logged back in. All right. So as we wait for Dr. Johnson to jump back on, I'm going to talk about a little statistics before she get back here. Do you know that there's a big disparagement of African Americans that are hospitalized, and also I got you back. Do you know there's a lot of disparagement with a lot of African Americans and blacks that are hospitalized, and there's also a big statistic of how African Americans, they struggle with having or getting or receiving the help that they need. Part of that is, the availability in the area in which they are. So I'm from a big area, I'm from Miami, and there's a lot of African Americans that are suffering with mental health. I currently live in a big city now, Houston, Texas, where there's a lot of disparagement with, access to help or needed help with African Americans. And sometimes we have people that live in these big places, and the idea that blacks will receive the help or they're not worthy of some help, it doesn't help them. Sometimes the prescribers, either the nurse practitioners or the doctors, they will give them some medicine or they'll give them their treatment-based ideas or their treatment plans, and it doesn't work out well for them. Part of that is because there's not a real understanding of where they come from. So the idea of knowing and understanding where people are in life is also playing towards how we can give them and how they will benefit from the help that they will receive. So that's an important thing as those that work in the mental health field to understand. Well, what's also important with that is those who do not work in the mental health field that live with someone or notice someone that is having a mental health episode of how to help them. You know, we all have this thing called anxiety. Okay. This thing called anxiety lives within all of us. Okay. Some of us have masked that and said it's butterflies. I'll tell you now, there's no such thing as butterflies, right? Everything, we are all human. We have a naturalistic way to go about living our lives. And within our natural neurological body and our makeup, we have this thing called anxiety. You know, some people have anxiety about what they're going to eat, how they're going to live, how they're going to provide, you know, if they're going to be safe, you know, when they're driving on the road, they're going to get in an accident. So there's things all around us where we have anxiety. Sometimes there's a significant event, like I mentioned earlier about COVID, that will, you know, that has a pandemic level, or you may have an immediate emergency within your home or within your personal life that will lead you to have a mental health episode. Part of this is to know and understand what it looks like and what it feels like. Another part of that is to have somewhere or something that lends some sort of understanding and education to what we're doing, right? In our lives, we have been around someone, or we may have been that person that has experienced someone that has had a mental health episode. Part of the mental health episode, or knowing that someone is having that, is accepting what's going on. Part of knowing and understanding and moving forward with that needle is knowing that, you know, what I'm going through is natural, okay? Because we are human. It's a lot of times we try to control some things. We try to control our narrative because that gives us a sense of pride, belonging, and understanding. Another part of that is knowing exactly where it is and what it is that we're doing. See, when we are around someone or we notice that someone has a mental health episode, for those who are not understanding it, for those who do not understand what is going on, it is hard for us to accept or even understand. Part of this mental health crisis that we have now in 2025 is that more trauma is leading into people's mental health episodes. You know, you can have people that have had childhood trauma. People have things that have happened to them in their adolescent age. Some people have had some things that have happened to them in their early stages of adulthood. And sometimes when you don't address certain things, it will then just manifest itself in different ways, in different areas. Another thing about that is knowing and understanding that there's help that's out there, but I need to know how to seek that help and where to go to get that help. So I'll tell you, help is given in certain places, some things that are called like mental or behavioral health facilities, okay, like a place where I work. There's also places where people can go, such as clinics, where they can go and get help. But there's also something that's called a partial hospitalization program. Okay, so there's a difference between the three. All right. So to get someone to go to a mental or psychiatric or behavior places, what people will commonly call the crazy house. So I will tell you, as a mental health professional, there's no such thing as calling the crazy house. We do not use that terminology, okay? That terminology is for those who are uneducated. So we're going to be here to educate you today, okay? So when someone is in a mental health facility, what happens with them is they get assessed, they get assigned a doctor, they're given certain medications at first, and it's based on if they're taking medications, and also based on if they have if they're presenting certain symptoms, okay? And what the doctor or the provider will do, or a nurse practitioner, what they will do is they will prescribe medication based on what the person is presenting. Now, I can come in and present something because I'm having a mental health episode, but once I start taking certain medications, then it would help stabilize me so that I can live my life and I can be situated with the life that I have right now. There's a big stigma that when people are being in a facility that they're going to get fixed. That is a big, big misconception. There's no way for one place to completely fix someone. Okay. When people go to these facilities, they're going to be stable, right? They want to get them on the right regimen, get them on a medication, get them with some tools and some coping skills that will help them. With knowing the tools and those coping skills and the medication, everything works together. It's not just one thing that's gonna just fix everything or take the place of one other thing. Everything works together. It's like baking a pie or making food. You have to put the ingredients along with the seasoning in order for it to come out with a finished product, right? So knowing and understanding those things is very, very important to see that when we get or we know that people are in these facilities, there's a process that occurs. And knowing and understanding that process is very important. Sometimes we get families, and sometimes it's the family that will drive someone to be in a mental health facility. It will also be some of the situations that person, that the individual is experiencing in their life, and family aids that situation. So sometimes we'll have small children in the facilities that I work in. The youngest that we can admit is 5 years old. And you think about that is pretty young. That child is still in its early stages of development until the age of 10. So there's going to be some things that child is going to display, they're going to exhibit, and the family have no idea what's going on. So we can have certain people in our family that are experiencing certain things, and we just don't know how to address them, or we don't know how to be there for them. The important thing is to treat them with love and respect, but to give them the same effort and energy that they're going to receive and that they need. So when they are going into these facilities, we want to make sure that they are on a good regimen. We also want to make sure that they are in a place where they're safe from themselves or they're safe from someone else hurting them. But we also want to make sure that we're providing excellent care for them. Now, sometimes you may have people that come in and they are very aggressive because they haven't taken medication, and that will lead to certain situations that happen. So I know people think that because they watch certain movies and, there are certain labels, certain social labels that come about. And as being an instructor for a behavior management system, one thing that I do like to tell people is that there's two words that we should take out of our vocabulary. We should take it out of our mental Rolodex. One of them being the term crazy. Okay. Crazy is something that we will place on someone because we don't have a clear understanding of what's going on, right? So if I were to look out there and I see someone doing something, I'm going to say, oh, that person's crazy. And it's only because I'm uneducated to what they're experiencing, right? It doesn't mean that something is really going on with that person that lend that to me. That just means that I don't have a clear understanding of what that person is experiencing, okay? Part of what people experience is, like I said, based on something that has occurred, either trauma triggered or something with life that has now stipulated the way that they're going to live, right? So let's talk back about COVID. That's a good example. Or you can talk about someone that loses their job. Or you can talk about someone that has a breakup, or someone that loses something that was very precious to them. And it can happen to anybody. And I want people to understand that, knowing and understanding that it can happen to anyone, especially in your household or to someone that it's very real. Mental health is something that we really need to bring to the forefront of people understanding and grasping this concept and this idea, because once we can acknowledge it, then we can move forward and we can do something about it. Okay. You'll see people that are out there and they have this push to say that we want to be there for someone mentally, physically, and emotionally. Part of that is knowing and understanding where they are at that point in time. Okay. So the one term that I will say that we should get out of our vocabulary and not use towards people is crazy. Okay. Another term is normal. Now, we are all human. Okay, we all live our individual lives, and we also live a life that is indicative to the circumstances or situations that have been afforded to us, right? Some of us are just doing the best we can, right? And in knowing that we're doing the best that we can and knowing that we're living our lives to the best of our ability, sometimes that is the usual happenstance of how we live, right? Now, I would sit there and say that, well, this is normal, or someone's not acting normal, but someone that's looking on the outside will say, well, what is normal? They're going to question that. They're going to question, what is the word normal? Why is this normal outside of what else is somebody is either experiencing or what they're going through? Knowing and understanding those two concepts is a better way to move around and know the people that you're dealing with, okay? I would like to use this, and this will further lend to your understanding. The term crazy and normal is derived from your personal experiences and your life, okay? It will be something that you have either lived through or your current life right now. So I'll give you an example. Something can happen right now, and there's a group of people that are sitting there, and two people may think that's a shock, right? And the other person may look at it and just wave it off like, oh, that's nothing. And those other two people will say, well, that's crazy. That's not normal. And then that one person that just scoffs it off may turn around and say, but what's crazy about it? Right? Sometimes we need to understand where people are. Yeah. People's experiences where they have are really derived from their upbringing, what happened in the home that they lived in, and also their experiences from early stages of development. Right? So once we understand that we know these things and how they're catered to us and the way that we're going to choose and make decisions on how we live our life and what we want to have for that, then we'll have a better understanding in that. Okay. Now I'm going to speak culturally. Okay. Everyone will resonate with this. And if you resonate this, you know exactly what I mean. Now, there's certain cultures, and I'll speak for the African American culture, that we know that there's a certain aunt, uncle, cousin, brother, sister that lives with us, right? And everybody will look at them differently based on how they're living their life, right? Sometimes you'll have the parent or you have the grandparent or you have someone else protect them because they are a little different, right? And with them being different, is knowing that they're actually going through something. And when I say the term different or the concept of being different is that they may not seem normal in certain circumstances. So we live in society, and society places certain stigmas or rules or a certain understanding for us to get on things and for us to know and understand where we are. But when that person doesn't live up to that, it's hard for them to live a life where they're judged by everybody else. Now, when they're trying to live that life and they're living the life that they can, or to the best of their ability, sometimes they have drawbacks, right? Now, when they get older, they'll have certain schools that they go to, they have certain programs they're enlisted in, or they'll go to hospitals, or they'll do other things to help maintain and stable their life. Once they get older, they will turn to maybe drugs, they may turn to alcohol, they'll turn to other things, and then that will further push their episode or their situation even further. Okay? So when we get people in my line of work that have been placed in a facility, we encounter people like that. We encounter individuals like that. We encounter individuals that struggle with using recreational drugs to supplement, the prescribed medication because it doesn't work well for me, or it may not help me in the idea or the concept of what I'm trying to do, right? The one powerful or the most important drug that there is and exists in a mental health or psychiatric facility, and that's cigarettes. Cigarettes have a lasting effect on a psychotic patient. When I was in college, I did a paper for one of my research classes. Okay. And because I was in this field, I decided, you know what, let me see, because I worked in a facility where patients would smoke, and I really wanted to understand what was the big deal about and why patients will react a certain way when they couldn't smoke. Now, I will tell you that's earlier in my understanding in my career, so I'm glad that I took and I had that idea that I wanted to know more why this was so effective, because once they smoke and they take 2 or 3 puffs, they start to calm down, things start settling down, they start slowing down their speech. Everything works out well for them after that time. So doing this research, I look back, and it started back in California, okay? And if you've watched this movie called Shutter Island with Leonardo DiCaprio, it's going to make some sense. So a long time ago, there was a doctor in a psychiatric facility. A long time ago, they used to call them psych asylums, right? And in this facility, there was a doctor, the medical director, that wrote to Philip Morris about a trial that they wanted to try of giving patients and individuals cigarettes. And what they wanted to do, they wanted to study the effects of cigarettes based on how effective they were, or if they were effective as compared to medication that they were going to give to them. Now, back then, you had to think about medication at that time was still trial and error. So there's a lot of medications that's out now that really weren't available then. So with the idea of him writing that letter to Philip Morris and getting these cigarettes, they sent truckloads, 18-wheelers, truckloads to this asylum, and they would hand them out instead of giving the individuals medication. So they'll give them a test period of when they're giving them the cigarettes and when they're giving them medication. It sounds like a lab rat to me. But in my research, I saw that there was a statistic that showed if someone was having a mental health episode or a psychiatric episode, how fast they calmed down when they had 2 or 3 puffs, or their anxiety lowered, or they were able to think clearer, or their speech slowed down. And when I started reading that and I went back and I applied that to work, it made perfect sense. It gave me a better understanding of the people that I came to interact with, because what it did was it helped me lean towards knowing and understanding the people that I come to work with. Now, in the facility that I work with, in one of them, patients are allowed to smoke. They have multiple smoke breaks, right? But to know and understand why that cigarette is important, because some people, they smoke a pack a day, maybe a carton a week. They have different cigarette smoking patterns. And some of them, they use that cigarette as opposed to taking medication. And with taking that medication, sometimes they are not educated when that medication doesn't work to say, or go to the doctor and say, this is making me feel funny. I don't like the way what it's doing for me, and I need to try something different. I had a show a couple of weeks ago with a doctor of pharmacology, and he said that some medications are given to us African Americans based on, the idea that we can handle it, or we can give it, or we can take it based on our history, right? And not necessarily with genetics, or not necessarily with trials, because we won't be open for trials, because I don't want to go down a rabbit hole because of some other things that were held within that show. If you want to go back deeper, you can go back and look at that episode and you understand what I'm saying. So knowing and understanding that cigarettes are very important when people are having these mental health episodes is very important when you're dealing, or you're in a situation when you're working with people that are having these crisis situations. One thing that I've noticed and I've learned within my 20 years of working in this field, I've learned a lot about myself. I've learned a lot about my past, and I've learned a lot about people that are around me, right? So I'm able to catch on and see some things. Now, some people will say that that's a little judgmental, but when you're engulfed in something for so long, and I wouldn't say I'm an expert, I would just say every day I learn something different within this field, because you are going to learn something different in this field. If you're truly open and honest with learning and knowing and understanding this field and how to help people, then it will magnify the help that you're giving them. You're going to give them different treatment options. You're going to give them some things that are going to be beneficial to them. Everything is a case-by-case basis. What works for you this time on this admission is going to be completely different maybe on another admission, right? So that's the inpatient process, okay? I want to move forward and talk about, you know, the PHP process. So a PHP process is called a partial hospitalization. Okay. Partial hospitalization just means I go to a clinic, I check myself in, I go see a therapist, I go through some groups. I got your back. I got your back.
My goodness, it's a storm over here. I don't know what's going on.
That's okay. That's okay. I got your back. Don't worry. We're good. So I'm talking about PHP clinics right now. So part of patients going to PHP clinics, they can go there and they can get the help they need based on the groups. They have different activities for them, and they also have some things that are prescribed to them, such as medication. Do you want to tap in and just give your insight or a little bit of input about the PHP process when it comes to patients and mental health?
Yeah, definitely. I will say I actually worked at one, and you know, a lot of times, well, let's just say inpatient wise, you know, when you get a patient who has an example of a situation where a family member was a you know, deciding factor on their admission. So, you know, not a serious case, just say it was something more of just, you know, life things happening, life stress just taking over, and then just a general meltdown that, like you said, any of us can have at any opportunity or any point. So with someone like that, I would definitely be encouraging them to, you know, do a partial outpatient or partial hospitalization program where when they leave, you know, they can do therapy and then kind of just help themselves, work on themselves. If there's any medications that we gave during the hospitalization and that they found that worked, you know, that they actually gave a chance to, you know, it's a place for them to continue that medication with the guidance of a provider that's there to help modify to the correct dose, you know. So sometimes when you're in a hospital, things are really, really great. Then you leave, and then it's like, oh wait, it's not helping as much as it did before. I don't know what's going on. It's the environment, you know, the distractions. When you're in the hospital, you don't have to go to work the next day, right? You have a child, so you don't have the extra added stress. So reality hits, and it's like, well, what do I do? So like you said, instead of shutting down, you know, you have someone there that can raise the medications for you. You can work on therapy, get through any of the trauma, individual, group, hear from other people who are going through what you're going through. And it's very, very beneficial, you know, partial hospitalization, intensive outpatient, you know, those are really, really great programs that many of us don't know about.
Just so everyone knows, the area where Dr. Johnson is living, they have a major thunderstorm right now. Okay, so her connection may go in and out, so for everybody to know that. So I was just telling everybody that you have a major thunderstorm where you are, so your connection is cutting in and out. So that everybody knows and understand that. Right, right.
Yeah.
So I want to read a statistic. Black adults are 20% more likely to experience serious mental health conditions like depression and generalized anxiety disorder. Okay, Black emerging adults are more likely to experience mental health problems than white emerging adults. Okay, Black people are more likely to present with more severe chronic illness. Dr. Johnson, why do you think that is? Do you think that's based on their environment, or do you think that's based on maybe a genetic or hereditary thing that's now in the early onset and now it's just bloomed to be something now?
I think it's both, honestly. I think the environment, like as you said, shapes us. You know, your upbringing, your household, your finances, your friends, you know, your school. You know, that shapes us in so many ways to where, you know, it kind of determines how we respond to different experiences. So also genetically, you know, there are things such as, you know, like depression and bipolar disorder. Those are genetic diagnoses that it's highly likely that if your mother or your father carry that, you know, illness or, you know, mental health issues, that you will also have a higher risk of developing or manifesting, you know, the same symptoms or that leads to the same diagnosis. Also, though, I will say that we are often misdiagnosed.
Yes.
We, as you said, as a culture, very resilient. We are often looked at like, oh, they can handle it. So a lot of times we're misdiagnosed when, like as a child, I see many children coming to me and they're being misdiagnosed as having a behavioral problem in school, but the child is really depressed. It's
Right.
even, that nothing's wrong, but they're labeled after that. From seeing a provider who didn't listen and didn't really try to understand where they were coming from. So now the child has a label that says he's a problem, and then he comes to me and it's really he's depressed, and now I'm trying to help the school or help the mother and father and the child learn that he's not this, he's not going through this. This is what he's going through. So let's figure it out. So it's a lot of all of those things, but being misdiagnosed is a major, major issue for us.
I'm glad you brought that up because in my experience working in this field, sometimes you would have doctors or providers that know they have to do an assessment on a patient, or when it's their turn to come and see a patient that is Black and African American, and they will give them a minute amount of time to get their feelings and, their wants and their needs heard, as opposed to, Hispanics or whites. They will sit there and they'll have all the time in the world to listen to them. One thing that I did, and I noticed that when I did this research for today's show, is that in 2024, 21.4% of Black adults experience a mental health condition in that year. It doesn't seem like a lot, but that's a lot. And that's on the top tier of what that is, because 7 million of Black and African Americans, they're suffering. I don't want to say the word suffering, but they have a mental health condition. Some are misdiagnosed, as you said, and some of them are undiagnosed, because we're battling with trying to keep things on a level playing field so that we don't show certain things, so that people won't think that something is either wrong with us, or they will label us as crazy and we need to act more normal, right? Do you want to touch on that for a little bit?
Yes, definitely. It actually shapes kind of like how I start off. I like to start off just meeting you. Let's just talk. Why are you? What brought you here? What do you find that you're dealing with the most? And so you could be comfortable, because in order for me to make an accurate assessment, diagnosis, I need an accurate assessment. Your history, it means everything. So if you're not comfortable enough to talk to me, then I'm going to get pieces and bits of the puzzle, and then how can I accurately give you a reason or answer behind what you're dealing with and why you're dealing with what you are. People think that if they come, medications is always going to be the answer. Medications is not always the answer. A lot of times it's just having the knowledge behind what it is you're dealing with, and helping you understand that you have to talk about it. You have to be able to express it, and don't just, we like to carry that burden sometimes, where we don't want to be a burden, but we'll carry everyone else's. And so I find patients will hold back, and I'm like, it's okay. And then once the tears start rolling, it's like, okay, let's let it out. This is fine. And then
open door.
Yes. And then once I can gain your trust for you to know that I have to know what you're dealing with, then I could accurately help you. We've got to open up. We've got to say what's going on. We've got to talk. And we said if we don't understand it, how can we do anything about it?
I think a lot of part about this, the Black trauma, and if for those who have listened to Kendrick Lamar's Mr. Morale, he had a line that said, "What do you know about Black trauma?" And then when he said that line, and I'm sitting here thinking, I'm like, that says a lot, just those words right there, because there's a lot of things that we experience, as such as trauma in our home, or as we grow up in our environment, or even racism for where we are. And we can live in a small community, or we can live in a big city, and there are certain things that are going to be afforded to us and not afforded to us based on who we are, what we look like. Both the two of us can walk down the street and we would get eyes depending on where we are right now, just because of our skin color, right? Not because of who we are, what we have, what knowledge we have, or anything like that. So their perception is their reality. Now, when we have patients that go into these treatment facilities, or they go in and try to get into a partial hospitalization program and they get misdiagnosed, it's partly because I don't want to tell you everything, because I've been taught that if I tell you too much, then you're going to do something to me. And I am not going to know how to deal with that. Okay. And I know that's something that you probably see a lot with in your expertise and in your level of professionalism, that you see that people, they struggle with. Okay. Do you want to talk about a little bit about how it is when you get a patient and you decide that you want to either admit them, or you're going about thinking about what type of medication you want to start them out on?
Yeah. So so we have two sides of this, right? You know, hospitalization, if someone, let's just start with the partial hospitalization part before they actually get there. You know, when you meet them in that kind of setting, either setting, the first thing you need to do is kind of just decide, you know, where they are mentally right now. You know, are you able to reason with them? Can I, you know, because you want it to be a mutual decision. You don't, you don't want to have to force anyone into a hospitalization. You know, just you don't want to force them to go to the hospital against their will, because you're already trying to fight the stigma of mental health. You know,
Right.
You know, so you try to do that. You know, but you know, in certain cases, you have people who are coming through and they are psychotic. You know, I've ingested this substance. I don't know what's going on with me. So there is no reasoning, you know. So you try to reason. If you can, you can. If you can't, you can't. But once they're in the hospital, you know, there's processes that we go through to try to see if, you know, we need to kind of isolate you from all of what you just ingested, you know. So keeping you calm is what we focus on. Safety, your safety. So we try not to give you anything at first until we, you know, it's something that we have to do. So in a situation like that, calming you down, you know, if you're very irate, all over the place, screaming, danger to yourself, you know, we would give you something like everyone knows, right? Like Xanax or Klonopin, something like that, that'll help you calm down, you know. And then once we have an opportunity to reason, then the goal is to try to figure out what's going on. What's going on? Why did this happen? Because if it was because you ingested something, well, problem solved, right? It's out of your system. It's more of education now. Why are you, you know?
We're going to wait for that thunderstorm to pass a little bit.
Do you have an addiction problem, or is it something you want to do? And then, you know, we help you in that way. But we have to be able to reason and understand first, so we can know what we're treating. You can't just give someone a medication based on, you know, guessing. You know, of course, like I said, of course, we know what does what most of the time, you know, such as a benzo calming you down. You know, some things do have a direct cause, so we don't really need to know what you're going through. But certain things like depressive medicines, you know, we don't want to give depressive medicines for individuals who have certain mood disorders, you know. So listening and understanding what you're treating is the biggest thing.
Good. I want to touch on the stigmas. I want to touch on stigmas. We face many stigmas. Many. Can you share with me your experience within your coworkers or within where you work right now about the stigma of blacks and mental health?
Yeah, I think, you know, overall, I hear my patients say we have a right to have this feeling toward medicine and just healthcare in general, right? So I always say, well, why? You know, tell me why. Like, I have my reasons why, but tell me why. So I always hear, because it's history. You know, it's been shown, you know. So that's the biggest stigma. Historical factors that have led to, you know, like you said, going down that rabbit hole of being, you know, test dummies for certain medications and things of that nature. But, you know, I'm even faced with a stigma as your provider, because I find, you know, that there are certain patients that they'll give to me. And I'm like, well, should I go down that thought process of why am I always, having this specific caseload or case population? And I can make myself believe anything beyond that, but I do think that there's a lot of stigmatization on both sides. But as far as my patients, there's a big stigma also around like religion.
Yes.
The stigma of go pray about it, or God will fix it, which is, if you have that religious belief, that's very important, because we're not saying that that's not going to help you and not going to assist you, but it's limiting us as a community in a black culture to even seek the professional help beyond that. So we're suffering longer. That brings in that resilience. We're taught to be strong, to hold it in, to keep it going. Don't let them see you fail. Don't give them what they want. Those type of discrimination, remarks or racism thought process. So a lot of that is the stigma that I see, and not having enough black providers. There's the stigma around that. Well, how do you want me to come and see this person when they don't look like me? And I'm like, well, I'm gonna go and find you a black therapist then, if that's what you would like. I'm gonna do what I gotta do to help you feel comfortable, but take the opportunity. So the stigma is a lot around culture, history, and then just a lot of upbringing and what we don't see as far as representation of our own.
Right. That's major. You talked about religion, and we probably talk all day about that as being a mental health professional, of why and how people will make people think that it will be all right if I just give it to God, right? Because that's what we've been taught, right? I can go ahead and just give it to God and everything will be fine. I'm going to pray about it and it's going to be okay. And part of that is like not knowing and understanding or being educated enough to say that, yes, you can do that, but there's some other stuff that we can do that's going to aid in helping this person in this particular situation. Okay. What is a reward for you to work in this field? Because I don't think people really understand how difficult working in this field is. Working in this field will take a lot out of you. Sometimes you will second guess if you want to be in this field or continue to do what you're doing. What is a reward for you to work in this field?
The biggest reward for me is being another representation for my children. Allowing them the opportunity to see that it's okay to just not be okay, and that I'm here to break all of those barriers and all of the stigmatization comments down, and make it a more comfortable place for us. That is the biggest reward for me, is whenever I hear my patients say, I never wanted to do this, but since talking to you, you've made me feel so comfortable where I now know that wasn't my fault, or I'm not to blame, or I'm not going crazy, is what they say. And then just, trying to be the biggest advocate for, breaking generational curses or generational habits of silence.
Yes. That's big. What was your decision that led you to work in this field?
Okay, so my family is huge. And it goes back to being in a small town with the generational silence of, very religious. I grew up non-denominational, in church 3 to 4 times a week, and so I do know prayer works. I do know how faith affects us mentally, but it was a lot of trauma that I experienced on my own, but was never really allowed to speak about it, or never was encouraged to go see the shrink, because that's what it was called at the time, or,
right.
The pediatrician was a family doctor, so there was nothing put in place for us to not only had the knowledge that this type of help existed, but nothing was shown. You didn't see anyone around you go and say, oh, I'm going to talk to my doctor because I feel sad or because I feel down, you know. And in my family, a lot of alcoholics, a lot of schizophrenia, bipolar, anxiety.
I'm going to wait for a little bit for her feed to clear up a little bit.
You know, trying to educate family and letting them know that it's not your nerves. Your nerves ain't bad. That's anxiety, like you just said, you know.
Right.
But in
Right.
the hospital as an acute care, especially during COVID really hit hard for me, having to watch my own culture be treated differently, honestly. And then a lot of mental illness emerging from that was not just from that. It was before that, but it just became more prominent, more at forefront, because we were faced to deal with it, because we couldn't go anywhere, right? We couldn't go drink to solve our depression. So being able to be in there as a hospitalist, you know, helping you on the medical side, there was a lot of the mental that was missing. And I knew that if I didn't do something, you know, then these people would be scarred for a long time. So I found myself as the nurse at the bedside at the time during COVID, just kind of helping out by sitting and listening. And you weren't supposed to stay in the room. You weren't supposed to stay with them. You know, you were supposed to leave. But how I couldn't leave. How could I leave? And they're crying because there are other family members dying. You can't see them, can't talk to them because COVID, you know, isolation, you know. So mental health was kind of hitting me at the same time. And when COVID, laxed and we were able to, you know, come together again, it was a matter of trying to figure out drastically drawn to mental health and started working in mental health facilities and just went back and said, you know what, I need to do this. This is what I feel comfortable with. You know, I want to be a part of this. I want to help someone all the way. Not every time someone comes in a hospital, it's a heart attack. It can be anxiety, you know, or you're stressing too much. So now you're leading yourself to have heart disease. You know, and in our community, those are big things, you know, the stress or just the diagnosis of diabetes and heart disease. So what else can I do to help my family or my people or anyone? So that drove me to go back to focus on mental health. And I feel like it's what I should have been doing my entire life.
Okay. That's good. What do you like the least? Because I can list I have a long laundry list of what I like the least about working in this field. And I'll just say one right now. It's not just the treatment that our people receive, it's the access to a lot of other opportunities that are afforded to them that they don't know that they have. So in your experience, what do you like the least about working in this field?
What I like the least is not having the resources myself to help others. So sometimes you can have all the help you need as far as the people to go to, but then it's the behind the scenes stuff of fighting with the insurance companies to get this patient the help they deserve, or having to gain your trust of not using you as a lab rat, but having to make you understand that the insurance wants you to try this medicine and this medicine and this medicine and this medicine before we can get to the one that I truly feel is going to help you the most, you know, or the one that I have a 99% sure of an understanding would be a better fit for you. You know, I find that that's my biggest struggle in this field alone. It's just trying to fight the things behind the scenes to get my patients what they need.
Okay. That's good. That's good. And I'm glad you brought that out as a provider. I think another part of thing that I like the least is that when it comes time to educating the individual and the family, I don't think I think what we do is we put a Band-Aid over what's really going on because we only have a certain amount of time to actually help people, as opposed to there needs to be something that's backdooring opportunities for them. So if I'm gonna suggest that this person, after they've been inpatient, to go to another facility, I need to have them be on board with what I'm doing. So it should be like a bridge from here to there. So that's like saying I'm going to go get surgery, and then as soon as I'm done with surgery, depending on what type of surgery I have, I don't have to do a follow-up. I don't have to do any physical therapy, that I can just go and resume my same activities. And that's a major thing that I see, that's one thing that I really dislike with how we're treating people and their minds, because, the mind is the strongest muscle in the body. And especially if somebody has like a TBI, or you said earlier when people are having drug-induced psychosis, which people don't understand that you can turn yourself into a psychotic person or have a psychotic episode based on the recreational drugs that you take.
Right.
Can you talk about a little bit about the differences if someone has an early onset to a full episode, as opposed to what it looks like when someone has taken something and now they're having a psychotic break?
Yes. So, I guess an example of what I could give is early onset of, let's say, early onset of bipolar. Okay. So typically, a bipolar diagnosis cannot be given until you're around age 18. But manifestations can start to present as young as early adolescence age, which is usually about age 13, 12. So a lot of early onset symptoms is usually depression. Depression is a major early onset symptom of what could manifest late as bipolar. Or, it's very hard though in that age, because of the age is going to come with puberty, right? So they're having the mood swings. They're having I don't know who I am and what I'm doing, and I'm very impulsive. So peer pressure, I'm trying this, I'm doing that. So paying attention to early onset of signs and symptoms, just keeping it in the back of your head that this could potentially manifest into this diagnosis is a big thing. It's more about pattern-like behavior, right? So watching how are you responding to this? It's not just like a one-off thing where you all of a sudden had a mental health issue or got angry. Uh-oh, I think I lost you again.
We lost Dr. Johnson again. As I said earlier, they're having a major thunderstorm where they are right now, where she lives. But I'm glad that she is talking about some of the things that she is, because part of being an African-American person, an individual that works closely with mental health patients, it's very important for us to know and understand where they're coming from and the experiences that they have. Another part of that is being open and honest with the people that you're coming to help and meeting them where they are. And sometimes we will place on people our ideas and ideals of how we want things to be, but it's not necessarily honest and open. So I'm glad she's touching on some of that. Don't worry. I know you got a thunderstorm going. You're good. We're going to keep rolling. Don't worry about that. As they say, one monkey don't stop no show. The show will keep going on. We're going to keep trugging. We will keep trugging. You want to finish your comment about that?
Yes. So I was basically describing that, manifestations on early onset to late onset is more so pattern-like behavior. Identifying what could present now, but it's just usually on more so on what is continuously being noted. When it's something like a psychosis or drug induced, right? It's something as far as something that's going to happen instantly. Most of the time, it's an instant thing. I all of a sudden went injected this substance, and all of a sudden I'm acting out of character, right? Something that's not usual of me is happening now and presenting to my family. And I'm psychosis. What is psychosis, right? So psychosis is a matter of us not being present with reality. So I'm either thinking things are there that's not there, hearing things that are there that is not there. I am unreasonable, right? So you can't reason with me. I have no understanding at the moment, and my behavior is unpredictable. So, and usually once the substance is gone or faded out of our system, then the behavior is gone. The behavior is not there anymore, or I'm more calm, or kind of confused a little bit on what happened. May not even have memory of my actions and behaviors. So, the difference is usually after you ingest a substance or something is substance induced, it's gone. But I will say something like alcoholism can potentially turn into, a memory issue where you find yourself being diagnosed with early onset of Alzheimer's, but it's alcohol induced, people think that, now it's genetic. Alzheimer's, no, Alzheimer's is not genetic in that instance. It's substance induced, by alcoholism. So I say that to say that even a substance induced situation can still manifest into something later on, late onset. But usually, typically, if it's not a chronic use of a substance, it'll be an immediate occurrence, event, until the substance is gone out of our systems, and then we return to being how we were prior to using.
Right. You touched on, and I want to transition a little bit because I want people to understand this: the role of the family. The role of the family when they have an individual that's either experiencing their first episode or if they've had multiple hospitalizations. And I know as being a nurse practitioner, you have sometimes, depending on the age of the individual, you may have more of interaction with that family as opposed to depending on that age. Can you tell me or tell everyone a little bit about that interaction and why the family plays a significant role when it comes to either treating or diagnosis or with prescribing medication?
Yeah, I can tell you, like for you children, so with a child is a product of their environment, product of their parents. So for the most part, it's the hardest assessment. And I'm speaking most of what I'm saying from an outpatient standpoint, right? I have a private practice, so that's what I'm speaking the most of my experience on here today. But it's important because are those parents under any influence, right? Are they in their right mind? Is what the child coming here for a product of a psychotic parent who's thinking the child is doing or saying, and the child is really not? Or is it the problem more so of, the lack of understanding of my view of how this household is raised? So a lot of my questions are, tell me what the typical life in your household looks like. What are some things you believe in? What type of parenting styles do you have? What makes your family, so different? So if I have a child who's never parenting with consequences, right? But the school is constantly calling saying that they need an evaluation because their behavior is, their conduct is all over the place. now, we're going to constantly suspend the child, and this is what's going on, and they can't even get an education because they're never at school, right? So then they come to me. So I have to ask, okay, so if the child is doing, is being angry and throwing things, what's their consequence? What do you do? So a lot of it is facing the parents head on and making them understand, hey, I'm not afraid to ask you the hard questions, right? Because sometimes you're the problem and the child, nothing's wrong with the child. So and I'm very comfortable with politely letting the parents know that your behavior is manifesting this child's problems. So so asking them how the household is, things of that nature, trying to just get more of an understanding of parenting styles is very, very important. And then letting them know that what they're doing is hurting their child, or what they're doing is causing these problems, because and in a way that gains trust, so sometimes I'll throw in some experiences of my own that I've struggled with my own children, because like you said, that follow-up matters. If I can't get you to understand what you're doing, and so we can figure out what's going on with this child, you're never going to come back to me again. And then the system will continue, and then the follow-up is going to be gone because, and then the child's going to be lost, and affected by the whole situation. So it's a slippery slope, but we also have to understand that family is a matter of just as important as the patient who comes in. Everyone is the patient, if I'm making any sense, right? If you're the parent, you're my patient, because I need you to treat him or her. So identifying issues with the family and the household is going to matter on what we do and how we respond with the children. Or the adults, same thing,
Okay, that's good. I have one final question for you today. In your opinion, what would help our people know and understand that mental health is real and important?
Talking. We just gotta talk. I think we need to understand that, yes, representation of our own is very important, but why hold out until we get there? We're only hurting ourselves. So even if you have to go to someone who's not of your culture or your background, we have to start somewhere. So be cognizant and aware of mental health is what you're feeling. It's what you're going through. It's what you went through. It's driving our actions and our thought process. So if we don't open up and we don't speak about it, even if it's to a friend or a trusted individual, it doesn't have to be a medical professional that we open up to and we talk about. It could be parents, it can be just letting them know the hurt of the trauma. If you don't have anyone to verbally talk to, write it. Get it out. The purpose of what I'm saying is get it off of your chest. Get it out. Journal about it. My patients, my black men, I'm getting a lot more, and I'm intrigued and just honored, honestly, because I get to help you identify that we don't have to be strong all the time. We can talk about it. So I have, I hand out journals. I have some that I give my guys, or books, let's talk about it. The whole purpose is we need to talk about it more so that we can start breaking down these generational, statistics on us not helping us, and being too strong and carrying it, and then it's affecting our children, and it just becomes a generational habit of, just not really getting where we need to be in life, and just learning that it's not mental illness, it's mental wellness. How can I help myself mentally? It's mental wellness, not mental illness. Nothing is wrong with you. This is something you're going through. It's a part of you. How do we get you to where you want to be? So just understanding that is where we start.
That's good. That's good. Well, I thank you for your time today. I know the thunderstorm is coming through. Don't worry about that. We still got the information out there as we needed to. But once again, I do want to thank you and give you your flowers as being a young African-American person that has achieved a lot, but you're pushing the meter. You're creating waves. And I would just suggest that you will continue to do that and that you will bring more people to the fold because, as you said, representation is very important. For me to know that I'm safe and I'm trusted, I have to know that there's somebody that looks like me and understand where I come from. And they wouldn't understand some of the difficulties that I have faced in my life because I'll be more willing to talk to them as opposed to talking to anybody else.
Yes, yes. And please.
Any last words from you?
Please keep doing what you're doing because when this was brought to me, it's not something that I ever usually do, but I felt honored because it was a black man, and I'm really saying this with a lot of grace behind it because we don't get to see this, and as a black woman, my husband is the biggest rock that I have when it comes to keeping my mental wellness in check. So when I get to see that being put out there by you, it's going to help, other women who don't have what I have just feel more safe, more comfortable that you're speaking to other black males, in a way of letting us all know that this is something that needs to be addressed. This is something that needs to be spoken about. And it just gives me a lot of hope for the future to know that, your message is getting across. And I don't really think how big it is just from the perspective that I just mentioned from a black woman.
I appreciate that. I appreciate that greatly, greatly. All right, that's our show for today. I want to thank Dr. Johnson again for being part of the show. Join me next week when I'm going to talk about truth and lies. This is AP for the Black Male Podcast, and as always, be good to yourself and be good to others. Peace.